Another commissioner.
No, this is just a committee. Good afternoon. We're here in the 9:03 for the Human Resources Committee meeting. There is a copy of the Open Meetings Act on the wall as you enter the room. We are here for one agenda item, and that is the discussion regarding the selection of the health insurance consultant broker. And we'll just go around the table and introduce ourselves. I'm Commissioner Marianne Borgeson, Douglas County Board.
Karen Butch, HR Director.
Colleen Frederickson, Benefits Manager.
Shamar Nutt, County Clerk's Office.
Carol Donnelly, HR.
Tim McNally, HR.
Diane Carlson, Deputy County Administrator.
Kim Bolo with Administration.
Patrick Bloomingdale, County Administrator.
Ian Shada, Alliant.
Megan Septak, Hub International.
Jeff George, Hubber International.
Marty Lockton.
Debbie locked in.
Anna Evans, Holmes Murphy.
Bo Reed, Holmes Murphy.
Louis Jimenez, District 1.
And on Zoom. Want to
Hi,
start, Nick?
Nick Long. Yeah, Nick Long with Alliant and NACO.
And we also have Marco San Martin, who is our Assistant County Administrator. And Sandy Conley, who is with
Chief
Chief Deputy Clerk's Office. Okay, so with that, we will go ahead and who's gonna start?
I'll start it out. So staff, we're currently, the county uses Lockton for its health insurance benefits consultant. We've had them for 5 or 6 years. I remember exactly 5 or 6, one of those two. And it's been a good experience, but we felt like since we're a public sector entity, we need to go out every now and then and see what else is out there. So we did the RFP and we ended up interviewing Alliant, Hub, Lockton, and Holmes Murphy. Is that correct? Just those 4?
Yes.
And HR staff put together a spreadsheet, kind of showing the different elements of each of the proposals. And then when they're done talking about that, then I can talk about what our, staff's recommendations are.
Yeah, I was on leave, so the people that made up the committee that was in the interviews included, I believe, Patrick, Diane, Tim, and Colleen and Carol. So I think Colleen, if you want to go over the bullet points.
Okay, so we received the RFPs and came in and interviewed. We set up interview all of them. So high level, all provide a proprietary data modeling tool included in the annual fee. All provide open enrollment assistance, compliance calendars and booklets. And all of them may charge additional fees, mailings and customized IT products, which is normal. The costs, range from 40,000 to 58,000 report annually. We did interview, we looked at, 4 places, 4 companies. With Alliant, we've listed that there's an office. So one of the questions we asked is, if your office is located in the vicinity of Omaha, and each of them did have an office in Omaha. A couple of things that we also asked for was consulting experience, any tools, additional costs, and what else can they provide? One of the things with Alliant is that we noticed through the interview, we noticed they had 1 local staff member assigned to Douglas County. They did have additional staff, but it was only 1 person in Douglas County for that face-to-face. With Lockton, they had 2 members assigned to us. And they have an Omaha office over 60 associates. But Lockton in our experience, we've had a high turnover of associates in the last few years. Holmes Murphy, when we interviewed them, they would assign 6 staff members assigned to Douglas County with additional specialty staff. And their office in Omaha has over 50 employees with 40 employees dedicated to service. They also offer the compliance consulting. They all offer, it's, you know, and then Hub, they have 4 staff members assigned to Douglas County, and there's a couple of things that we asked for and they didn't get back to us. So that's the rundown of each one that we had that determination.
They had prior, just to give a little background to the commissioners and other people that are here, that they had prepared off of the RFP spreadsheet that was went into great detail about all of the vendors who responded. That spreadsheet compiled basically the various benefits of going with that particular organization, and also set things up so that they would know what questions to ask during the interviews. And we have that spreadsheet available if anybody would like to see that. Any of the staff, because there was some information that was shared with us that was proprietary that they asked us not to share, so we can't distribute it to the vendors.
Okay, so are you done with your part?
I believe so, yes.
All right. Sorry about the coughing. This, I get emotional about this, I guess, and I'm all choked up. So there was positives and negatives about all of them. Staff was, I guess, as far as the presentations, they, for the most part, were all pretty strong. And we were really probably most impressed with the Holmes Murphy presentation. This number of, just how it was presented, the number of local staff, the training that we can get for free. Alliant also right up there. If Holmes Murphy would be 1A for us, which they are, 1B would be Alliant. We'd be happy with Alliant as well. They obviously don't have as many local staff. There's some training that we could get, but we'd have to pay for. But that really wasn't, the training really wasn't a deciding factor because that wasn't included in the RFP. Locked-in, I guess we weren't as impressed with the presentation. There's been just some issue with turnover, I guess. We've had a good experience with them, but and then Hub, it's just the numbers, the cost is just so much higher. There's a $2,000 difference between Holmes Murphy and the Alliance and Lockton, but we felt like that was not enough to really make a difference. So, it's our recommendation. If we have to make one that is so close, it would be Holmes Murphy, but we would be happy with, if you wanted to select Alliant, that would be fine as well, but that is our recommendation.
Any questions or comments from anyone on that?
And then that will come before the board, I would assume, on July 8th. I mean, we have to make a,
Contract ends July 1st, and we have to get it to the county attorney.
and we have 2 meetings in July. So if we do it July 8th, there'll be enough backup for July 27th or whatever date that is, if we need to delay it. So, but I think, again, all of the companies and representatives that presented, and it's not easy. It's never easy. I've been doing this for a long time. I've always had to make recommendations. It's never easy. It's not fun, but we did the best. We're pretty confident with our recommendations.
All right, any other questions or comments from anyone? All right. Boy, this is gonna go fast. So you heard that the recommendation will come to the board on the 8th. If there are any additional questions or comments between now and then, please be sure to get a hold of us and let us know. Otherwise, we will discuss and ultimately, it'll be on for discussion / action on the 8th of July.
Do you want like open for comments or?
Quick question before we go. Well, I might have missed this. How many, did we, the four were narrowed down from how many that responded?
6.
6, okay. And they all know, right? At this point, they've been informed?
No, sure.
Okay.
Or,
I suspected that might be the case. Is there, are there points of information that would like to be disseminated right now that haven't been, I guess?
Well, my last thing was to ask if any of the folks from the companies wanted to say anything at this point in time.
I would just say it's been a pleasure working with all of you, so thank you for the opportunity and building this relationship and for the opportunity.
Yeah. Oh, Nick, do you want to say something?
Yeah, absolutely. Thank you for this opportunity to kind of listen on the discussion. We have enjoyed working with Douglas County on your enrollment and ancillary lines, and we'll continue to work with you in any way that we can. I think one other thing, which is a little bit unique that we're bringing, is the partnership with the National Association of Counties and a variety of products that kind of specialize in large county governments. And so while we probably do as many or more public entities in Nebraska than anybody else, we sure do a lot of counties around the country too, through that association with NACO. And thank you.
Thank you. Anyone else? And again, the board will have discussion and there's a recommendation, but it goes to the board for final approval. So that'll be on the 8th.
Question.
Go ahead.
What was that spreadsheet you were talking about?
This is it. I called it a spreadsheet, but I didn't, this is the format they put it in, unless you have something else, but that's what I was talking
You mentioned it. would be a
Yeah,
spreadsheet.
yeah, we
Oh.
had a spreadsheet that we put together of all 6 vendors that we had in the beginning. Help us kind of narrow it down to the 4 on which we did interviews.
And you said that was available or not?
no.
about. That's their internal.
Yeah.
It's got
Internal work.
Proprietary information that we
So it
promise
goes-
to disseminate.
It goes to the commissioners though.
Well, I mean,
No.
if the commissioner asks for it, I suppose we'll have that conversation, but
And
it's
the
not,
R-
that's not the intent.
It's not gonna be
the
on the
R-
agenda.
The RFP are available
Yeah.
publicly.
Yes, the RFPs, although if the companies ask for a portion of it to remain confidential, we would comply with that.
Redacted.
Well, they may provide certain information that the whole document may be
Mhm.
unavailable, and that's normal part of the RFP process.
But I can get like a PDF of the proposals.
Yes,
That they're not marked proprietary.
yeah, the RFPs are available.
There's a couple of them that have proprietary on it.
Yeah,
We're not gonna, yeah, we'll have to talk to the county attorney about that, because I'm not gonna release anything that says proprietary unless we
Mhm.
have to.
right. Well, we can't, I don't think, because we said in the RFP that we would keep the proprietary
then
information
that answers
confidential.
that
That's the
question.
policy.
Mhm. That's part of the purchasing process.
Okay. All right. No other questions or comments? With that, I just want to thank everyone for their work on this and thank you all for being here today. And again, if you had any other questions or comments between now and the 8th, be sure to let us know. Okay, thanks.
Mm.